Hello everyone, my name is Mason and I am joined by John, Kat, Amanda, and Matt, and we chose to research the grand challenge of engineering better medicine. Some of the topics we will cover are why this challenge matters, how sound separates cancer cells, and how it was discovered. Imagine a future where cancer is only a zodiac sign, where being sick is the only way to describe something awesome, and where diseases like autism and lupus can be treated safely and naturally without any harm to a person's mental or physical well-being. Now, if that doesn't send chills down your spine, then I don't know what will, because that is a future I want to be a part of. And now, my colleagues will tell you one way that engineers are working right now to make this future a reality by using sound waves to separate cancer cells from healthy blood cells.
In the United States alone, over 1.6 million new cases of cancer are diagnosed each year, which is a big problem. And over 600,000 deaths occur from cancer alone in the United States, which is an even bigger problem. So obviously, developing a more effective way to treat cancer will save more lives. There are effective treatments, but a lot of them are bad at targeting cancer cells. They actually attack the normal blood cells that the cancerous cells are attached to, leading to a drop in blood cells, fertility issues among women, and also it hinders memory. When doctors treat cancer, they locate the circulating tumor cells first, also known as CTCs, and these cells are attached to tumors which break off and then spread throughout the bloodstream, attaching to new normal cells, thus spreading the cancer. So doctors attempt to separate these CTCs from the normal blood cells, which is an extremely difficult process, as CTCs are about 1 in 1 billion in every blood sample. So after doctors eventually separate these CTCs, they attack and then treat the CTCs to terminate the cancer.
So how the technology works to separate cancer cells from the bloodstream would be that different acoustic pressures push the cells flowing through the buffer stream different lengths, and so they'll flow into different channels, thus separating the cancer cells from the rest of the bloodstreams. And because the distance of movement depends on the size, and cancer cells are bigger, they're going to move less distance, and so that way they all get separated into the inside stream. And so how it works is that there's two transducers on each side of the flow stream, and those create a constructive wave interference, creating one big wave with multiple pressure nodes. As the blood flows through those pressure nodes, the different cells react to the different pressures, moving them a different length. So the blood cells are going to react in a much larger quantity to the pressure, and so those will move farther out of the stream, while the tumor cells, because they are bigger, will move on the inside of the stream.
The idea of using sound waves to separate cancer cells was developed by Drs. Huang, Dao, and Suresh. The inspiration for this idea came from the way doctors use low-power ultrasound to safely monitor the development of a fetus during pregnancy. After 4 years of work, they were able to use their sound-based device called the acoustic tweezers to separate breast cancer cells from normal white blood cells. This is extremely important because the separation of CTCs allows for specific diagnosis of the different forms of cancer, more accurate prognosis, and the appropriate treatments. The current methods for separating cells involve attacking them with chemical or mechanical forces, which can cause the damage to normal cells. The use of sound waves can isolate cancer cells without damaging normal cells.
With the sound wave method previously described by Kat, isolating cancer cells takes about 5 hours in comparison to 50 hours using previous technology. So we have an idea. It's been tested. It does prove to separate cancer cells from the bloodstream. What do we do now? The next step is engineering a product for cancer patients that can not only be cost-effective, but easily manufactured and disposed as well. We can't make a product that is going to cost an individual $50,000. The public will need this product at a reasonable price. In addition, a process must be established in order to mass-produce the product. If it takes 20 labor hours in a lab to produce just one of these cancer separators, the price will be driven up, and only a small proportion of the cancer community will get the opportunity to use the product. Third, this product needs to be disposable. Nothing in the medical field is recycled or reused, especially when it comes to products involving blood or working in contact with blood. This is where engineers step in. With the given requirements, engineers need to develop a reliable process which can turn this idea into a reality and help treat cancer patients by producing an acoustic cancer cell separator that is cheap, mass-produced, and disposable. Connecting this all to the grand challenge, we're trying to establish personalized medicine, in which case we're able to isolate CTCs And when we have these separated cancer cells, we can use various treatments on an individual basis now that these cells have been separated. And in addition, we can discover new treatments more suitable based on individual differences. And here are our sources. Thank you.